maybe you can post your questions in the chat box. We will pick it up, and maybe at the end of the session, you will be answered. Okay, before we start officially, uh, good afternoon and good evening to all of you. It's my great pleasure and honor to welcome Ms. Vhs George, the speaker of the today's session, Career Guidance for Nurses. I'm really surprised, and I really got inspired by reading her resume. So it's a pride for me to introduce Ms. Vhs George. First of all, I would like to thank Dr. Prema for introducing such a vibrant person. And I'm sure, dear faculty members and students, today is Teachers' Day. September 5th is a Teachers' Day celebrated in India. And it's very apt that today we have Ms. Vhs George with us. She is also an excellent teacher. Today we have Ms. Vhs George with us to tell about career guidance for nurses. The knowledge which you are going to gain out of her presentation is something different. But the knowledge which you are going to gain out of my introduction about Vhs George is something 30 to 40% about career guidance, because her resume is the testimony of her career growth in the profession of nursing. So once again, I feel proud to introduce Ms. Vhs George. She has started her nursing education, the Bachelor of Science in Nursing from Armed Forces Medical College, Pune, India.
I'm sorry, is it just me or you cannot hear?
Vijay, even we are not able to hear. I think an internet, there is a problem. I think she has gone out of the meeting. She'll come back again.
Okay, no worries. I just wanted to ensure.
I will just wait.
Okay.
Yeah, that is it, because even I thought it is thing. In the participant list, she's not there. I think
Yes.
her internet would have had a problem.
All right, no worries. We'll manage around the technology. No worries.
Hello. Hello.
Yes, we can see you.
Yeah, sorry. Again, technical difficulties. So I have joined through my mobile. So that's what, it's again, like technology is something which is very useful. At the same time, we should know how to handle it. Yeah. So again, I would like to introduce you as an energetic and positive persona and a vibrant leader and educator.
Thank you.
And a leader and educator who strongly believes in live for today and learn forever. I'm remembered of Gandhi's quote, like live as if you were to die tomorrow and learn as if you were to live forever. So Ms. Vhs George is a self-directed and change development healthcare leader, currently working as a clinical excellence program manager and magnet program director for a large multi-hospital healthcare system in North Texas, USA. Started her career as a military-trained nursing officer with extensive and diverse multinational nursing experience. Students, please understand, underline multinational nursing experience of more than 27 years in clinical, administrative, educational, staff development, and clinical excellence program, including evidence-based practice and research. Her area of expertise is wide. From clinical to administration and education, staff development, and clinical excellence. And professional summary, it goes like this: Magnet Program Director, Magnet Champion, expert in Magnet application process, and ANCC designations. You must be wondering, what is this Magnet Program Director? So earning Magnet recognition from American Nurses Credentialing Center is a huge achievement for a hospital that shows what nursing excellence is, and they follow high standards. Role of Magnet Program Director is of vital nature. It is really challenging, rewarding, and they work for quality and standard. They are the key person to communicate to American Nurses Credential Center and help the organization to grow. In her professional development, she has attained the highest level, that is level 6 of Nursing Career Advancement Program. She has attended and presented in many national and international conferences and sat on many leadership interview boards, chaired a regional conference committee. And clinical, she has worked in level 4 NICU and took care of high-risk deliveries and managed care of extreme premature and high-risk neonates in a highly complex and intensive work environment. She has served as a clinical resource person, competency validator, EPIC super user. Again, EPIC, it's a certification she has obtained. Her educational skills, again, she's an ardent learner, educator, perceptor, mentor, actively involved in development of continuing education, present nurse planner. She has coached and developed nursing students and nurses in pursuing educational and professional development activities through educational workshops and webinars. Participated as member of organizing committee for educational conferences and workshops at national and international level. Taught as instructor for clinical education, CPR, neonatal resuscitation program, and stable programs. Again, stable for sugar, temperature, airway, blood pressure, lab, and emotional development. She has participated in various national and international venues on professional development, neonatal nursing, and evidence-based practice speaker, panel member, and moderator. She has got publications in her credit, she has got publications in Nurse Leader Journal, Virginia Henderson Repository, organizational newsletters, and professional organizational souvenirs. Her work experience, she has started as a military nursing officer and program director for nursing assistants in Pune, India in the year 1992. Then in 1996, she has become a nurse educator in Muthoot Medical Mission, Kerala. From 1996 to 2002, she has served as a clinical instructor, nursing supervisor, staff development administrator, Armed Forces Hospital, Kuwait, and as a staff nurse for Center for Discovery Harris in New York from the year 2003 to 2006, and clinical nurse in NICU Westchester Medical Center in New York 2006 to 2008. Again, clinical nurse NICU is the Texas Health Resources Presbyterian Hospital, Texas. And currently she is working as a clinical excellence program manager, Texas Health Resources. So she is a registered nurse from state of Texas and New York, and registered nurse and midwife from India, certified nurse for high-risk neonatal intensive care, NRP instructor, BLS and CPR instructor, Institutional Review Board certified researcher, and Texas Christian University evidence-based practice fellow. Her professional achievement goes like this: Nursing Career Advancement Program Committee Chair, Professional Practice Development Recognition Council Co-Chair, Care Connect Coordinator for NICU, Care Connect Super User, Clinical Instructor, Preceptor, Mentor, IRP Certified Researcher, Evidence-Based Practice Fellow, Evidence-Based Practice Mentor, Magnet Champion, Magnet Program Director, Clinical Nurse Leader and Professional Development Mentor and Coach, Shared Governance Program Coordinator, participated in organizing committees for educational conferences and workshops. She is a member of so many professional organizations like Sigma, National Association of Neonatal Nurses, North Texas Association of Neonatal Nurses, Collin County Area, Texas Association of Neonatal Nurses, National Association of Indian Nurses of America, and Indian American Nurses Association of North Texas. She is a chapter leader, Sigma Theta Tau International Honor Society of Nursing, Global Leadership Mentoring Committee mentee for Sigma, Professional Development and Education Committee Chair, Executive Board Member, Indian American Nurses Association of North Texas. She's a recipient, she's a honoree of the Paulette Burns Graduate Nursing Scholarship. And the awards and recognitions received by Ms. Vijay George's Best Nursing Officer Award in the year 1993 from Military Nursing Service India. In 2000, Best Nurse Award in Armed Forces Hospital Kuwait. THR Trailblazer Award and Discoverer Award for Outstanding Achievements. Peak Performance Award in the year 2012 for being one of the top performance in Texas Health Resources. Nominated for 2015 National Magnet Nurse of the Year Award. Mosaic Pin Award 2016. DFW Great Hunter Nurses Award in the year 2017. Exemplary Professional Practice Award in the year 2019. Doctorate of Nursing Practice Students Spotlight 2020. Excellence in Nursing Award 2020. So as I said earlier, the resume itself tells how she has grown professionally, and it's a great honor, a person who born and studied in India. Now she is doing a great job in US, and she is such a role model and who's here to inspire us and motivate all our students. I'm sure all our faculty members also inspired by her, by learning to understand Ms. Vijay's growth in the profession of nursing. So, Ms. Vijay, it's an honor and pride for us to have you as a speaker. So, you can start your session. You can just share your screen.
Thank you, Dr. Sudha. I shared my resume for the paperwork and gave a short paragraph for introduction, but I didn't know that you're going to read my entire resume. It feels like, you're talking about someone else, not me. Unfortunately, unfortunately, things have happened, but basically I consider myself as a learner, so I cannot stay still. So some of these things are about that, but I also do get that maybe you intentionally did this to let the nursing students know that what this career guidance for nursing is all about, what and how you can grow. I have learned over the years many things from many places that I worked. So thank you. It's a great privilege and honor to be here with each one of you to learn as well as to share with you and the entire people who are here with our Q&A session. Today, I want to, dedicate this to all the nurses who are practicing nursing, because this is International Nurses Year, right? And especially this year, due to COVID, people have seen all over the world what an amazing profession nursing is. Being Teachers Day today in India, I also want to dedicate today's presentation to one and all teachers who helped me to reach the place where I am here today. I'm still learning, I'm still in school. We'll talk about that more. I just want to state that I do not have any conflict of interest. All that I'm going to share today is entirely from my experience and research, and it doesn't include any of my past or present affiliation to any organizations or institution that I belong to. We are going to keep it very focused, and the objectives for our presentation today is to understand the nursing career options, identify some of the national global nursing opportunities, and discuss some of the tips on the way that I learned from my mentors and from my own personal experience, like how to know when the opportunity is right and how to grow if that's what you're aspiring to grow in your career. Let us focus on a few words when we are going to think about a nursing career. These are the words we relate to something that we work, right? A job, a career, a profession. What does a job mean? A job means that it could be anything. It could either require a skill or not skilled, or education or not formal education, to do something and you get paid for. So I can, if I have passion as a gardening, I can be a gardener and get paid for, and that's my job. I can attend a table, be a waiter, I can get paid, and that's my job. Or I can work in an office or in an assembly line in a factory. So that's what a job is like. It doesn't require, they may not formal education. Some of the jobs will require, but that's kind of a category. A career is you start a job, you start working, and now you want to grow up in that. A few will stay where they are for the entire life. Many times we see, certain people start as a laborer and they stay there as in a labor status. If you've got a little bit more activities, involvement, capabilities, you may grow up to be the team leader of that group. Or, if you add up more education training, you can grow up in the path. So career is very much towards what is directed towards yourself, to the person. Whereas the profession is, it's got an organized body of knowledge, theoretically proved, has got a lot of practical implications, and you require, a set organized program, a training, a degree, and it is not only about you, but it is also about others. So some of the example of the profession is like teaching profession, nursing profession, medicine, civil services, police, any of those kind of that you see where it requires a formal training. And some of the professions require a license to practice. And we will talk about that in a little bit. As today's topic is mostly directed towards nursing students and also young nurses, I just want you all to think, I got my nursing degree. Now what, where I'm going to? So that's where we are going to focus on what all that you can achieve with that nursing degree in your hand. I love this beautiful scene. I wish I could stay there, right? It's a rainforest. It's so beautiful. I can just enjoy that and be there. This is the same thing. Become comfortable where you are, whether you are in a desert, a rainforest, beautiful place in a hill or near ocean. That's all you want, that's fine. Just live there, be in your comfort zone, do your 8-hour shift, 12-hour shift as a nurse, and that will be more like a job for you. Like, you're just doing your job and coming back. So do you want to convert this profession that you are entered into from a job to a career that you can grow into, or a profession that you're passionate about? Are you in this profession just because you wanted to do something, just to get money, or is it just to serve others, or you want to have something for others as well as you, right? So that's what we need to look at. So how will you know? If you're living in that jungle or in that little place, that's all you have seen, only one hospital you worked or one school you've been in, you just in the local area, maybe that's, and you're comfort, there's nothing wrong about it. There's nothing wrong about it. It's all what you want. If you're comfortable with that, that's what your aspiration is, perfect. But when you come out of that jungle, think about like an eagle, okay? As you go uprise, you started getting to know, oh my God, this is not the only little neighborhood that I live. There are multiple neighborhoods like this. The higher you go or fly up or come out, you realize there are so many beautiful jungles out there, or oceans there, or places there, and there are so many opportunities out there. And this eagle also gives me an idea about, even for the learning, the more you learn, the more you interact with people, the more you try different things, the better you know, the better decision you can make, and you find your passion, and your profession will not be a job anymore. It will be your passion for your life, right? So that's what we want to focus on. When you come out of this college with a degree in your hand, what all you can achieve and become. So we'll look into some of the national and global opportunities, because each and every place, the way we work is different. So in the Eastern world, and especially let me see about India. India is one of the largest, I would say a place where the nurses are going to school, and we produce, if that's a word you want to use, the nurses. It's like we are famous for producing the largest number of movies. So because why I'm saying that anywhere you go in the world, you will find an Indian nurse, you know, and they are highly regarded for their skill, their expertise, their knowledge. But why is it that only in India we are not considered that much? And that's a different topic to look into. But maybe because in India, the nursing is not autonomous. Autonomous means completely on its own, independent to make all the decisions. We are still under many other bodies, organizations that we are subjected to for our management, for our practices, and for our water. So we have to rise up to other professional level to establish ourselves as an autonomous. Having experienced that and having experienced some of the Western nursing organizations and professional opportunities, I understood, and I'm fortunate to work in a place where nursing is an autonomous, and I can see as nurses what a power we have, what authorities we have, how much we can influence in the care of a patient. Hospitals are mainly run by nurses. Nurses are holding executive positions. They are the board members. So one time, even in a hospital that I worked, the hospital president was a nurse. So those are the things that you can achieve being a nurse. But can you become an expert overnight? Or when I got my degree, here is my BSN, I can be an expert nurse. No, it doesn't work like that. Getting a degree is only maybe, I would say 30 to 40% of having that foundational knowledge about a profession. But the rest of like a foundation of a building, the rest of the things you have to start building each brick by brick to build that structure that you are visualizing for yourself and for the profession and for others. So I want to share here the novice to expert model by Dr. Patricia Benner. This is a call a novice is someone who is just new, brand new. When you get that degree, no experience, even though you had some experience in your clinical practice. And this model, I'm sure those who are in master's or graduate school, you might have heard about this. And I'm not sure if others also, but you come out of an educational program, you have that knowledge, but you do not have that experience, you are considered. As you go, you're expected to become a kind of little bit more advanced, so advanced beginner, eventually competent, right? I would say in my experience, I've worked in different places. It takes for you to know any new place. Think about the first time you joined college. It took like 4 to 6 months for you to get comfortable to know the whereabouts. And after 1 year, you become a little comfortable knowing. And by the time you are third year, fourth, you become a little bit more confident, competent. So that's how the journey goes in profession or in your work, wherever you are. And eventually you become competent for you have been trained for in your profession. Not everyone can become proficient. For proficient, you have to be adding more depth to it. Those who are proficient, you start taking the positions like head nurse, charge nurse, become managers, directors. And by the experience and by the growth, you may become expert. No one can be an expert in everything. Expert is that ultimate, you will be expert in certain things, but then you will be considered expert maybe for a clinic or one specialty, your management styles. But if you're passionate, you can adapt, learn, and do so many things to consider an expert by your professionals in the hospital, not only the nurses and beyond. So that's how this journey grows. And where you want to be, you just want to be there in the beginning stage and be just happening and be in that advanced beginner, or do you want to develop, grow slowly to become an expert where you feel that I am doing something that is meaningful, not only to me, but to others for a more fulfilling life. So this is it's a collage of pictures of the places that I worked. I've been trained as a military nurse, and I worked in, teaching schools as a lecturer. And both in military and civil setup, I got to work in India and also abroad. I also worked in multi-hospital, organizations. I worked as clinical instructor, but I don't want to go into that because doctors already read what I wanted to mention here. So with all the different kind of experience, and both in clinical as well as administration, educational, and now in a position to as a program manager, where I'm looking forward to the Magnet program. So mainly I have the designation also of the Magnet program director. Magnet program is the epitome of nursing excellence. It's kind of the gold standard of nursing. Some even say it is like the Nobel Prize that a hospital can get for its expertise of the nurses and the patient outcomes. So anyone who is going for care in a Magnet hospital, their the outcome of patients' safety and their less infection, and the nurses are happy, they are highly educated. So that kind of a excellent standard that it is. As only 8% in US are Magnet, and many of the international hospitals are also Magnet hospitals. And in India, we have yet to come to that. I mean, it takes a long term to achieve to that standard. There are so many things to meet to. But let's not talk about hospitals. Let's talk about individuals. How can we achieve to an excellence by growing step by step in our career? So let's see what are some of those nursing career opportunities you have that you can look into. In general, people think that, okay, I got my BSN, I will work in a hospital. I got my master's, I work in a school or a college to teach, right? But there's so many things that you can do with that degree when you start adding more and more layers of expertise and knowledge and programs and certifications and other things that you learn on your path that you've not learned in school. So there is clinical nursing career that's very role specific, mostly around the hospitals or wherever there is a direct relationship or care with the patient. It could be disease specific, specialty specific, it could be facility specific. We'll go into these details. In educational nursing careers, you will see like professional teaching, like how you in this college and all your professors, they have some nursing career background, right? Then you can be a nurse in the school, you can be out there in the community teaching, or you can work in the research area, learning something and sharing that with others. This advanced level, again, I personally divided into just to understand how these things are. The advanced level nursing requires additional experience, additional training, additional degrees, or some kind of additional thing that helps you, to some kind of those expert level is what we are trying to tell to reach to that advanced level of nursing. So in the clinical nurse, depending upon the role, if you are a new nurse, you'll be a staff nurse or a clinical nurse. If you are a little proficient, become confident, you can be a charge nurse, then you're in charge of other nurses as well as you're also taking care of patients. Nurse supervisors, head nurse, different terms are used in different countries. Then specialty wise, if you're working in ICU or acute care areas or critical care nurse, critical areas, so it could be critical area for adults or pediatrics or for neonatal. So that's where my clinical expertise is neonatal ICU. Orthopedics, it could be plastic surgery, geriatric, old people, operation room nurse, operation theater nurse, whatever, different terms are again used, psychiatric nurse, occupational health nurse or employee health nurse. Occupational health, certain occupation has got certain hazard. Like for example, those who work in an oil factory, those who work in coal factory, their occupational hazards are entirely different from people who work in a hospital setup or people who work in a corporate setup or an office setup. So not every organization may have an employee health nurse or occupational health nurse, but wherever there is a perceived hazard or health hazard, you will find a group of nurses or one or two nurses, depending upon the size of the organization, an occupational health nurse or an employee health nurse. And pharmaceutical nurses who work with the pharmaceutical companies where they share their clinical expertise and judgment in medications and all those kind of line. Then again, depending upon some of the facilities and areas, emergency room nurse, that is the casualty, this is another word that they use. Then oncology and home health nurse. Home health, I know personally from my experience in India, so home health is not that you get 3 months training and come and take care of a person who is sick, like, just helping the basic care. Any person can do that. I feel each and every person or a mother is a nurse, right? Anyone who has a little caring nature can be a nurse. And the mother is naturally has those nursing capabilities. Maybe that's why women are more seen in nursing profession than men. But the home health nurse, the home health is entirely a different organization out here where you are a visiting nurse going and attending patients in their house and using your clinical expertise to take care of them in their house. It's not just taking care of their basic needs. So the term that we use in different countries is different, but here I'm talking about a professional outlook for all the terms that I'm using. And hospice is people who are at the end of the life, right? Who are going to die. Their requirements, each and every specialty is very specific to what the need of the patient is. It's very patient-centered, family-centered care. Then traveling nurse, those who travel, those, don't want to be stuck in one place. So there's a board, that you go to different states, different places, even internationally, like you can, take projects. They have their contract workers. They got 3 months contract, 6 months, depending upon how each and every organization again working. And they have kind of like a supplemental forces to an organization. And in India, this is coming up. And I know a couple of my friends who are thinking, or, like entrepreneur nursing, they are thinking of establishing this kind of agencies and organizations in our country there too. Then military nurses, as I said, I'm a military nurse trained. The requirements of our training is entirely different. We were trained as military nursing officer. So we had military training as well as a nurses training. So I consider myself very fortunate to get a very disciplined and great training opportunities as a nurse. That has helped me to understand and to adapt to different places that I've gone to. In the military, they train you, drill you to that thing, like you stand out in a different way because you are trained that way. Transplant nurses, a lot of organ transplants are taking place, right? So that is a different kind of, again, nursing. In radiology is evolved into so many specialty areas in itself. So again, nurses are required certain clinical care there in the radiology department. Then wound care nurses, wound management is entirely a different specialty area. There are wounds that won't heal for months, sometimes years, diabetic ulcers issues. Those require, again, special training, the material, how to do dressing. There are so many amazing things I have seen done with these specialists there. Plastic surgery, again, a different, very highly specialized area. Parish nurse is not kind of existent in India, but here again is a specialty. We also call it a faith nurse. The parish is the word, doesn't mean Christian. It means to any faith, you have a specialized faith-related nursing approach. So nursing is caring, and whom do we give caring? To people who are sick, not feeling well, physically or mentally, right? And most of the time, people who are suffering are also closely related to attach or to that spiritual and faith. So that's why this combination of nursing expertise using faith. So that's a great place to, like, people have, they're fabulous nurses. You talk to them and you get the best of, like, you have that healing feeling with them. And camp nurse is, again, a site of clinical nursing where, those short camps are there. It could be like student camps or a short, any camp organization that is not in the mainstream area. It is somewhere outskirts, but there is a first aid requirement, bug bite, or any of those immediate care is required. Not very intense care, but that immediate care. And if there is an intense issues happen, the judgment will help the people to transfer the child or an adult, whoever is attending. Now more and more corporate people are doing like off-site events and activities for team building. So this is why a camp nurse will be some of those opportunities for to work. In the educational field, definitely you work in a school, this I'm talking about the regular school. Most of the schools have a nurse on board. Then nursing auxiliary educators, all those auxiliary nurses, certified nurses, or aides, those who help nurses. So in there, you can work in educating them. You can be a nurse educator in a hospital setup. You can be a clinical instructor looking at the clinical practice of the nurses. So you're not affiliated to college, but in the hospital you're affiliated, and you can still work in a hospital, can be in a department that is completely under the maybe staff development or education department. And so that is one. Staff development, and I have an extensive experience in staff development, is something helping the new nurses who come to the organization. You teach them, orient them, you establish them to develop and establish themselves in the organization, also develop and show them the opportunities available for them to grow in the organization. Then as an educator, you can work in nursing schools. And most of the people who are teachers who are attending this, here nursing lecturers or professors. Again, the term professor depends upon whether it is a title in some countries based on their experience and expertise. In some countries, you have to have a doctorate level and certain way of publications and presentations to up to a category to achieve that professor title. Then nowadays, online is a great platform. I've got some opportunities to be doing some educational activities online. So online program, that's also an education title. And I'm schooled myself, and some of the educational activities is through the online program educators. And patient advocate nurse, bigger hospitals, have you seen those issues that come where patients have got issues, patients have complaints against administration, against nurses, against doctors. So patient advocate nurse becomes an advocate for the patient. She goes and hears them and see what their concern is and give them the education, telling that this is what has happened, this could have been avoided. And based on their assessment, the organizations make their decisions. Again, in the community, most of the activities a nurse is doing is a community health nurse is the teaching, right? You're not giving much care, clinical care, there you're doing teaching. Disease-specific education like diabetic nurse educator, that is a role that someone can take, because of diabetes, people who have experience with family members in diabetes, there's so much they want to know, or they themselves are suffering from diabetes. I've seen people so passionate diabetic educators. My second pregnancy, I was a gestational diabetic. I work with a diabetic nurse, and I tell you that because of a strict guidance teaching, I was off of insulin and delivered a healthy, normal baby. So look at the impact a nurse can play in a person's life. And I still remember her name and her face, because that much she affected me to maintain my blood sugar level at that time. Telemedicine is a very upcoming field. Mobile health, we are using a lot during COVID. So telemedicine nurses are where a doctor is not required, where this is only again where a nursing profession is at an autonomous level, that you give advice, you screen them, triage, and do you need to go to the ER, do you need to go to the hospital, okay, take these kind of things. So those are some of the options nurse can have. Rehabilitation is someone is recovering from, say, a road accident, they have got multiple injuries and they need 6 to 8 months of recovery, or whatever debilitating disease, cancer survivors. So you are rehabilitating into those kind of, so they can be the long-term care. They don't have to be in the main hospital. There will be a different facility. So the nurses who work there, they work with physiotherapists, occupational therapists, speech therapists, depending upon the need. So that's, again, a specialty. Infection prevention nurses, they are considered as top nowadays because of COVID. They are considered as the top expert in our organizations. So, their knowledge, and that's how they educate the administrators and everything regarding specific infections, what is prevalent at that season or in that country, in that region, and advise the administrations and the staff to make the right decision. Now, nurse consultants and advisors. Now, what are the difference between nurse consultant and an advisor? A consultant is considered as an expert and in something, and they can be called on to consult on something. It could be a regular or a job. You can be a consultant in a biomedical company. There they are trying to, for example, find an equipment for endotracheal tube, something they are trying to develop. So they may not require a surgeon on board for that. A nurse's clinical expertise and knowledge is enough for them to give that the anatomical, all those kind of the advices they can give. That could be a concern. Or you can be called on to like kind of a traveling job. You can be called as a nurse consultant certain aspects, and you'll be called on to seek your opinion and what type of things that you want to do. Whereas a nurse advisor is someone who is advising with their experience and expertise to make a decision. Okay, so you become a part of a body, maybe could be like a health policies developing. A lot of nurses, wherever health policies develop, you always see a nurse on board. So those are like an advisory nurses. Nursing informatics, I'm sure all of you are familiar with computers, and computer is a way to, in the future, and also most of the hospitals are transferring to electronic health record, right? And I'm sure most of the metropolitan cities and also the other towns and cities are catching up all the records are going into electronic health record. Now, what we as nurses need to chart, only a nurse will know, right? An IT person who without any clinical knowledge will not know. They can develop a software, but for a nurse to understand, these are the requirements for my intake output chart. This is what I read. That's what a nursing informatics training, this is a master's program again. Legal nurse consultants, they advise the court people. There's a medical case and they need lawsuit that goes from hospitals to the court. The nurses special training, they have the knowledge about legal, and they also have knowledge about the nursing. They can advise about the medical issues there. Now, research nurse, they facilitate research. So nurse researchers are different. Research means it could be any research. It could be a government level research. It could be medical research or paramedical, any research, and nurse is there as part of promoting that research, working, taking blood, doing some of the teaching. So that was a research nurses. Whereas in the advanced level, nurse researchers means that the nurse is considered as mainly the doctorate. You require a doctorate level of preparation to be a nurse researcher, ideally a PhD, because all PhDs require to have an organized research done, right? PhD means research means you are finding a new knowledge. So if you become an expert in researches, you may be considered and be called into a hospital just to be guiding research in an organization or working in that. And that's how you develop from being a nurse researcher to nurse scientist. So see, these advanced level require minimum master's level, certain level of experience, expertise, and a passion. You cannot go to this advanced level unless either you have an advanced degree or you have an advanced certification or you have advanced practice and also some professional and personal passion. Someone who's going to a master's, that itself shows that you have that ability to take that extra step just beyond your BSN. So it itself shows that's why certain minimum requirement is master's. The certified clinical nurses in a specialty area. Let me give you an example of neonatal nursing. So I worked in neonatal area. Now I want to be, how do I know, or people will know that I'm an expert in that? You can work there 2 years, 5 years, 10 years, but then you have to write, you have to prove that, oh, I have all this knowledge. Whereas when you get the certification, that is again an exam, like a license, and you have to maintain every year this many CEs you have to attend, the education, you have to keep up with the certification every 2 to 3 years. You have to pay a fee, you have to take assessment, and you have to, when different certification has got different requirements. But when you have that certification next to your name, then it shows you are an expert in that clinical or whatever specialty. So when you see the names we normally write, people always ask, why do nurses have such a long, tail behind their name with all this initial, what does even that mean? So unless you yourself are in that professional, people who are looking for certain things, that's what they look and identify, know what are the background of that person, right? You do not have to read the entire resume. You will have certain things there that they already know that they have reached to that level. Nurse directors, again, when you become nurse executives, are all this, high management positions, administrative positions at level with other executives in the hospital. Hospital is not run by one person. It's a board of directors, board of executives. So a nurse has to be a part of that executive board, because a hospital, guess what? Almost 60 to 70% of the hospital is run by nurses. The biggest force in a hospital is nurses. So if you do not have a representation up to that level, then it's not good. So that to reach up to that level is what is, the executives and all that comes in. Then program managers or program directors are for certain programs, for like right now, for me, it's like nursing excellence program. So kind of we look into professional practice, professional develop a lot of standards to maintain that magnet standard, to be ensure system-wide that we are not only just doing the work, but we are making sure the nurses are happy, the patients are happy, the organization is happy. To become happy, you have to have a certain level of minimum requirement for everyone to work there is BSN. Minimum requirement for everyone to, everyone is encouraged to take a career ladder program, a certification. So we need to meet certain percentage and show that we are growing. At the same time, we are supporting. So these are some of the program management or different project managers out there as nurses. Nurse practitioners are specialized again, course, you have to go back to school. Those who become nurse practitioners have to take a board exam and are the licensed practitioners who can see patient and to a certain level can prescribe medications. So again, that is new in India coming up. It's a great opportunity. Those who aspire to become, doctors and wanted to, and that's what you want to give care. And especially they are developed to not practice in the hospitals, but in the community and in the rural where a doctor is not required. Again, nurse practitioner can be of different specialty. It can be adult nurse practitioner, depending upon what you are. Our family nurse practitioner, FNPs, they can look into different things. So when a person has got some minor infections, cold, cough, so again, they don't need to go to the hospital. They just maybe needing a prescription for antibiotics. So that's how it's a body of knowledge, organized knowledge that you need to have a certain training, certain license to practice as nurse practitioners. Then nurse midwives, like we all are, when you get for your BSN, you will be required to get registered. So in India, I'm not sure what it all has changed, but as soon as you get BSN, your teachers will tell you these are the forms you have to fill, you have to get your license. All that you have to do is give them certain forms, your degrees, and fill up a form, pay the fee, you're registered nurse and registered midwife for the rest of the life. So I'm a registered nurse and registered midwife from India because it doesn't require further training or addition to here. Whereas here, every 2 years to 3 years, depending upon certain state and where you're practicing, or different countries, you're required to get certain continuing education hours. You're required to apply. You are initially to get that license, you have to have a board exam. So once our profession in India to grow to that autonomous, that's where it will reach to, and that's where we are heading. And I see momentum in that direction. Certified nurse specialists, very disease specific. They are considered as experts. Clinical nurse leaders are working in the clinical setup, and certified nurse anesthetist is one of the most highly skilled people that I have seen. They are doing exactly the work of like any anesthetist. They intubate patients, they provide them medications. They completely do what an anesthetist does in an OR. But most of the places they're required to be practiced under the license of an anesthetist or a board of physicians, but they can still practice independently in many places, or they don't need to have for every surgery. Certain surgery they can. There are many, many advanced level of practices that you can grow into. If you have business acumen, you can become a nurse entrepreneur. Like, you have got this nursing idea. One example, actually, I have a colleague and a friend, she has doctorate and she's a great teacher. So here, a lot of Indian nurses are coming, right? So what they have to do, they have to come here, they have to appear for the board exam to get their license. So they have experience there, and the education, the training is great, but the exam for some is difficult. So she started a business as a NCLEX training center. So, and she runs that. She's also an educator as a professor. She's working in a college, as well as her main thing is, that's a visiting professor there, but her main thing is her business and is flourishing so well. She gets so many clients. So that's how there are so many opportunities you can take your nursing to different level. But let's also see, there are certain things that we need to maintain, that is the professional practice, right? So general nurse, BSN nurse, master's nurse, doctorate nurse, these are some of the terms we use. So minimum for a professional nurse is an associate degree or a general nursing degree, right? So that is a requirement. So if you're into 4-year program, then it's a bachelor's. Bachelor's is a little bit more theoretical oriented. And then from there, you need to have, previously there was a requirement of having 2 years of experience to get to that master's. So that's like, I'm always doing something in the learning, basically. Like, I love learning something. So I didn't want to wait that 2 years. That's when I joined to do master's in sociology. That's why I have the degree MA next to my name, because I love people. And I wanted to know about people and relationship. And that's how, when I became a fresh graduate, I didn't want to wait for my 2 years to get my master's to do nursing, but that was my goal. And I went and did my master's in sociology. So once you have that bachelor's basic, you can do master's in, find out what are some of the requirements that you can. You can have a master's, maybe in MBA, if you like to become a manager, director in that role. So fine, and so many online programs are there. If you're very passionate, you want to advance, you're a learner, you want to do research, you want to know something new, advance, or have a career passion of becoming a principal in college. So some of your, I'm sure some of the faculty in your team have this doctorate degree, PhD, and another doctorate level degree is a doctorate of nurse practice. So right now I'm in school for doctorate of nurse practice. The difference between PhD and DNP is PhD is research focused, academic focus. You are looking forward to looking into, finding something new in nursing. You're researching something new. And doctorate in nurse practice is same level of doctorate education, but you're putting that research into practice. So when you're working in a clinical setup, in a hospital setup, all this research has happened, but there's a big gap between the theory and practice, right? And as a student, you know that what you learn in the class is not exactly what you see in the clinical field. So that, to bridge that gap, even in the professional practice, that's why this doctorate of nursing practice emerged, and it's not that old. I believe it is around 25 or so years, and a great program. I enjoy, I love learning because my work is helping me to learn. My school is helping me to do my work better. Then for practicing nursing, we also need something called a license. Without a license, you cannot practice. Just with that degree, you cannot practice nursing. When I graduated, I remember our tutors made us to fill all this form. Oh, this is the thing, and what board of nursing that you can apply for. And we were in Maharashtra, so from Punjab. So you could take a professional license from different places where you want to practice. So some are very specific. For example, if you're practicing in Tamil Nadu, maybe the requirements are different. You have to have a board license from state of Tamil Nadu, or maybe when you are in Haryana, it may be something requirement. Certain state accept any license. So find out what is your requirement. So basically there is a, the nursing license that is, LVN is here, or, more of like in a practical, they do associated, you can have an LVN, they work in doctor's office and things like that. But a registered nurse is minimum requirement to work in any hospital setup. Then you can be a midwifery, so registered nurse as well as registered midwife. Here you can also become certified registered midwife. When you're a certified, again, you require a master's level of requirement and pass the board to practice independently as midwives. And that's considered again an advanced level of practice. Then APRNs, or advanced practice registered nurses, are those nurse practitioners who are talking about clinical nurse specialists, clinical nurse leaders. So to practice independently, those are the advanced practice, certain license you're required to do those kind of job. Now those are degrees and minimum license you need. But now how do you add up your expertise? So when you're in an organization, when you like certain, my passion was even from my school days, my passion was pediatric nursing. And then I found that, those little bitty babies, that's what I like best, to take care of the special care baby unit. And we learned that many books that is from the US. So when I looked into that, I want to work in a neonatal ICU like that. When life happened, I came to US. That's what I wanted to do. I thought I'm going to retire there, right? And I took an internship program, a 6 months of internship program, because I didn't have any experience in neonatal ICU. So I went back from the starting beginning, internship program of 6 months, and did. And that after 2 years of experience, only you can apply for, you have to again apply for an exam and have certain expertise to become certified. And I tell you that those are some of my best, satisfied, 100% satisfied moments of my life, of taking care of those tiny babies. We even take care of and I took care of babies less than 500 grams, babies as small as 22 weeks old were born at that age. So if you want some of those, that passionate about certain specialty, find out how can you develop into those certification. INC website has got some of those options that you can look into in India. It's developing again. There's certain things again require focus requirements. For example, for your principal's position. So your principal is mostly now not doing much teaching job. It's into more of the management administrative work, right? So you require She did not become a principal just in a few years. Her expertise, her knowledge, her experience, and things she learned that is required for administration and management is something very specific. Managing people is not easy. It's kind of like you're working 24 hours. I mean, you can relate to that, Dr. Sudha. And it is also a special, talent and leadership skills. So a manager is different, a leader is different. A leadership qualities are required to become a good manager. Then your professional expertise based on that you can stake against certain fellowship program. So there are leadership fellowship programs, you call like fellows. So I was very much interested into like research, evidence-based practice. Evidence-based practice is coming up new again in India. Research is very common. Everyone has a PhD. Everyone know about research. But evidence-based practice means there is so much research and we want to bring that into our practice, right? Let me just give you a big example. Earlier, I do not know if it is still practiced, maybe in the rural areas, as soon a baby is born, what they do, the dyes or the midwives or the nurse will take the baby off of, cut the cord, I'm talking about a full-term baby, go and give bath. Research found that as soon as a baby is born, do not take off, just wipe them dry, put the baby on the breast for bonding. For the first 6 hours, at least minimum, you should not even bathe the baby. Let the baby as much as possible bond with a mother's chest. The body temperature is maintained. The baby drinks milk fast. These babies are healthy. They go home faster than other normal babies. So see how that someone has done a research and we are bringing that, we are practicing that in our clinical practice. So that is, that's what an evidence-based practice and a fellowship program in that for you to understand how important that is. So these are some of the practices that you can work on. Now let me look into all these different careers that you can explore into, but how do you get there? So this is my strategy, the grow strategy. You want to grow in your career, grow. So grow stands for get to know, reach out, opportunities everywhere, work for it. So let's go a little bit onto that. What is get to know means? Get to know means number one is to understand yourself. Understanding yourself is very difficult. You have to know what you want. When I get that BSN, when I get that my MSN, or when I get this, that, where are you heading? What do you want? Is it that you want to make better money, or you want to go into teaching, or you want to go to a foreign country, or you want to have a lavish life, or I just want a degree, I want to get married and stay home. Whatever is your desire. For that, I mean, in 20s, I will tell you, I was there too. Don't tell me, and I read all, romantic novels and watched movies and been all over the place kind of a person myself there too. But I also had an undercurrent of knowing a little bit more about something. So that piece was always there with me. But in my early 20s, again, I didn't have a mission from my life. I didn't have a thing to like, oh, this is what I want to become. No. Life just happened. Okay, you got this job. I got posted here. I started working. Then marriage happened. Okay, parents are, you need to get to marry. Even, you are thinking some others are influencing. You are still, developing there. Maybe mid 20s, late 20s. I feel like you kind of like mature in your 30s. That's when, you see in life, maybe you had a couple of kids and things happen. Oh my God, this is not what real life that I remembered or read about or saw in the movies. That's not what real life is. So you have to have a mission, what you want from your life. Is it that calm and quiet life, or do you want something bigger? For me, at home, I'm a wife, I'm a mother, but my profession is what I give to others. And I feel I'm VG George because of my profession. That identity is, that's how I am connecting myself. But it's up to you how you know. So try to understand what you want. Know your profession is very important. What are the requirements? Where all I can grow into, what also, I give you much, I'm not going into depth. So trying to bring you all these global opportunities in a few minutes here. So anything that, even if you want to go to New Zealand, look at what all nursing options you have. What are the requirements to go to New Zealand? Okay, I want to go to work in North India, in Delhi, from Tamil Nadu, we want to go there. So what are the requirements to work there? How much the nurses are getting paid? Whatever that is, find out about your profession, find out about your organization. Organization doesn't mean the place that you work, but around nursing organizations, wherever you relate to. If you work in a hospital, get to know how they support nursing. I will only work for a place where the nurses have a voice, the nurses are recognized. I mean, up to this, I always wanted, like a person I wanted to stand up for. And also where I have a chance to learn and grow from one another. Not like a job. For me personally, it was not just a job. I knew that it's not just a job for me. Even though I needed that money, I mean, even though my job is my security, but I knew I want a little step beyond that. So find out what are some of those opportunities there, and reach out to your colleagues, your friends who have similar background, to your leaders, your managers, your teachers. They have been there, right? They have experience. See, listen to them. You may not be doing the same thing, but you will learn from them. That's helped me a lot. Like, listening from everyone and making my own decision. Now, mentors. Well, who is a mentor? Mentor can be, it's a two-way relationship. So in my role, I'm a mentor in different in different things. Like, so when I see a certain potential, a young nurse, she can be developed into leader. So I kind of like reach out to them. You know what? Try to become a committee leader. Try to take charge in a position. Take one extra step. Take one extra project. Something to like kind of like I try to. So experienced person is building up a less experienced person. Similar way, a less experienced can reach out to an experienced person. Dr. Sudha, I want to be a principal of a college one time. I want to be like you in my future. How can I become like you, something like you? What are the steps I need to take at this age? Anyone that you admire or aspire to be, reach out to them. I'm sure none of your teachers will say no. Everyone someone is admiring me or want to be like me, they will find, no matter how busy they are, set up and have the professional night rapport relationship. Ask them, can I meet with you for 20 minutes, 30 minutes? I just want to ask you a few questions. Get that appointment, talk to them, pick up that phone, get their numbers. That's how you establish relationship. What do you see here? I do not know what you see here. I definitely see that there is an opportunity, but I also see that opportunity is now here. Some of you may say that opportunity is nowhere. Those who see opportunities nowhere, you will be in that jungle of yours for the rest of your life. But if that's what you want, that's fine. We have certain pessimistic mindset people too. But for those who see that opportunity is now here, I personally believe opportunities everywhere. As a student, at your school, at your workplace, how many of you are just going to just attend a class, just do the minimum requirement of the assignment, just do the minimum attendance? But whenever your tutors, your lecturers, your teachers are asking for, we want volunteers for this committee, we want some this activities that we need to do we're having an event, we want this bill, maybe organizing a Zoom. So how many of you are going and volunteering? Those are the people taking one extra step. They saw the opportunity to learn from someone else. If you're in a professional organization, you're becoming a member of an organization, they say, oh, we need committee members. Some of the people, even volunteer. Most of the people like to sit in the back seat. People like one thing I learned is in a classroom and in a church, I'm a Christian, I always like to go and sit in the front, because then I'm not distracted with people. I'm focused on my preacher is saying or my teacher is saying. So same thing I learned eventually, like whenever I'm joining something is because I'm passionate about, right? I'm not taking a back seat. I want to volunteer, even if it is for 2 hours. They are doing an activity, going to serve a health kit in the slum area. I want to volunteer. I want to pack that bag. I want to give it there. So that's an opportunity in your community. So be that person, take that extra step. You may be having some inherent, but opportunity is there. Make best use of it. And sometimes you can learn these things too and see and learn from others. You cannot achieve anything without working for it, right? I mean, opportunity is there, opportunity is knocking on the door, but you have to get up, open that door for that opportunity to be yours, right? So find that time and prioritize it. See if it's a time right for you to grow into. Most of you, as soon as you come out of college, it will be your first and foremost requirement will be to get a job, right? Because what are you going to do with the degree, a professional degree, and not find a job? As soon as you get a job, your parents, family, others will say, okay, when are you getting married? when you get married, when are you getting kids? So know your priorities, know yourself, know your priorities. If you have got 2 young kids, you want to go back to do your masters. I mean, I'm not telling people are not doing it. People are doing it, but it may be tough. But is it the time right for you? Can you manage? Can you multitask? Can you have a support system to take care of your kids? You're not missing on them. So it's all what you want, but prioritize work if you want to achieve something. And set smart goals. Be smart, be smart. And now be smart means some people are naturally smart, but some people can be learned to be smart. I feel like over the years, I learned to become smart. And now smart doesn't mean that, oh, look at me, I'm smart. No, this is what it is, means like having such goals that is smart, that is specific, measurable, attainable, relevant, and time bound. I, for some reason, knew from even when I passed out, like in my 2 years, see, the 2 years I wanted to do my master's. In 5 years, what I wanted to do. In 5, I wanted to continue in military, but life happened, different places I, got to travel. But I learned a short-term goal for 2 years, what I want to do. So that is how you can set goal. Now it has to be attainable and relevant. Oh, I love spaceship. I love all those movies that shows, there's space related astronaut things. But can I become an astronaut? No, not now, not in my age, not with my physical capacities. I cannot be an astronaut. But yes, can I be can I achieve my DNP in my 2 years? Yes, I'm in school. I have to enroll in school. I have to do my homework. I have to reach the, yes. So something that is relevant to you and that you can achieve, and put a time to it. You may achieve, you may not, but at least there's a direction for you to go into that. Again, opportunities. When my kids were young, and here we have that facility, you can choose a shift, day shift or night shift. So I wanted to enjoy my kids. That were my priorities and my, love of my life. I wanted to spend most time that I wanted to attend the school events. So for 13 years, I worked night shift, and I worked in clinical level, in a clinical staff nurse level. I didn't even become a charge nurse because more responsibilities. I wanted to spend more, just do my 3 days. We would do 12-hour shifts. So 3 days work, come home, and spend time with kids, be in their school, like work sometimes maybe 2 to 4 hours. Sometimes I'm getting sleep to my 12-hour shift. But I wasn't young, 20s, early 30s, you can still got that energy to do. But I still worked on my clinical skills, my neonatal nursing skills, the technical skills. That's why all those, additional things that you have heard in that resume is like the computer charting. You won't believe, we never went to school for learning how you guys are learning computers in your schools, or you have a smartphone, you're learning them, or even the younger generation is technically made that way. But we learn as we grew. In my generation, I learned on job and different. So it was completely a different world. So anything that I feel, my God, I do not know, I find someone to learn from, or I take a special program and I want to master it, and then I start to teach it. Because when you learn, from others, you do it and you teach it, you become an expert. And that's the thing that my learning and teaching experience helped me to become, to reach up the highest level of the clinical expertise, that level 6 that is called, because there's a career ladder that you are doing preceptor, you're precepting others, like when the new nurses coming, you're teaching them. And I got my specialty certification, and also doing some, started attending hospital committees and taking leadership position like chair of a committee, or started attending special in-services, short clinical courses in educational field, any leadership course. Most of advanced or a bigger organization always have these free courses. I can tell you that except for my master's, that also there was not much money. And my doctorate, even for that, I got some scholarship. Most of my educational activities were completely organizational influence, because completely free educational events. For my license and for my certification, I had to have 45 CEs, and for license 20 CEs. All those I found free resources to get my CEs. Otherwise, sometimes you have to pay for all these educational activities. But to make best of this, if you love learning, if you want to go into teaching, or even if you just want to get that master's or doctor, whatever, then decide to go back to school, advance your degrees, advance your specialty, get into that education, get into that professional development. Anything someone is asking, just become a member. When you become a member, it's a minimum responsibility, just attendance. Then if you feel comfortable, take a leadership role, volunteer to do something extra, become a part of the hospital's committee. You know, hospital committees need nurses in there. And you get to see only few nurses are participating all the time. Why? Because people are not volunteering. Even in the professional organization tomorrow, if midwifery is your specialty, there are like, you know, there's so many other organizations out there. You can become a part of it and start becoming a secretary. Grow up into that if you want to be a leader, build up your skill. When there is a position that comes, you can put all these things in your resume. You don't have to say anything. All that you have this experience, and people will say, oh, she can manage education. She can do this thing. She can be fit for this role. That's how you develop yourself. This is a famous quote by Florence Nightingale. I attribute my success to this. I never gave or took an excuse. I relate to this a lot. I have heard a lot of things. Like when I was in Kuwait, you know, you cannot take much of the leadership positions or grow advanced much. Or it's always for, you know, for the natives, not for Indian nurses. You always hear, once you leave India, in India, you are the boss, right? When you leave India, then you become an immigrant. So it's a kind of a different setup. People always, you know, will try to move, oh, you will not be getting to, you know, I don't know, maybe that's what they're living in their jungle. They're not explored. I never took that an excuse. Let me try and find out whether I can achieve something that, okay, there's an opportunity there. And I can tell you right, like, not because of my skin color, not because of my nationality, not because of my gender, I was never, ever being discriminated for anything, or I'd never felt that way, because it is your experience, your expertise, and what you bring to an organization, what you bring to your profession is what ultimately matters for your professional growth. So I'm not going into this. This is already like, because I wanted to actually show you, like every time you can see from I'm just put into 5-year gap to tell, like, no matter where I was, I always did something in that 5 years gap. Currently, I do not require anything extra, but I am back in school. My kids are in college, and I always dreamt of going back to school. When they are doing their schoolwork, you know, I get excited. So I do short courses and everything, but I always wanted to do that ultimate, you know, terminal degree. So I said I wanted to do a doctorate. Then I explored what is the best for me. I don't want to do a PhD because that is very focused narrow into one, or do I want to do a little bit more? Because I'm a learner. I want to know a lot many things, and also want to share. So I felt that doctorate of nursing practice is best fit for me, and one of the best decisions I have taken. Yes, it is busy, but I love it. I always find passion and time, and also look at things like this opportunity. This is an opportunity. When someone asks me, you want to share? Because I'm all about learning and sharing and teaching. That's just naturally in me. That's how I grew. That's how I learn. No matter how busy I am, no matter what time I have to get up. I have done programs for Indian, some other schools and colleges and even organizations. Got up at 3 o'clock in the morning, 12 o'clock to 4 o'clock I've sat. So different times I've said, because I have an opportunity to know what's there on the other side. When you interact with another person, and now, you know, getting to know Dr. Sudha and your organization, I explored Google, your organization. So that's how, again, learning. It also helped me to reflect back, you know, a topic. This is a topic I was given. So how did I do? So it gives you a sense of, you know, kind of an achievement or satisfaction. Now, or a sense of success. Yes, you are successful. So passion, discipline, focus. This is what I would say the pillars of success is. Now, again, here, please remember what a success means. Does success means money? Does success means title? Does success mean position? Does success means fame? If success is fame, all movie actors, and all those famous people will be so happy, or will be considered. Why people are doing suicide? Why people are becoming drug addict? If money is that, all business tycoons or people, they will be happy and successful too. But not all people who have money are considered successful. For me, this is my definition. I feel success means you have a balance, an internal and external balance. That means you are content with who you are, how you look, what you have achieved with yourself, in your capabilities and your limitations. And externally, you're content with people around you. No one is perfect. I'm not perfect. No one around me is perfect. In the organization, that is not perfect. and the profession you have chosen is not perfect. So I would just quickly want to share one thing about which I share with my kids. I tell if my dad was a millionaire or we didn't have to think about money, art is my passion. I would have been an artist and I would have done some, um, charity works and did art and traveled around the world. If I had, my dad had more money, he was a government worker, he was the only earning member. So I knew I had to have a job. We lived a good life, but not like a lavish life. So I was a good learner. I made good grades. Even kids, beyond me, the ranks have become to with the medical school. I always wanted to help people and be in a medical field. I would have been a doctor if my dad had money. But this opportunity came for me to apply in the military nursing office because I said, there is no money. Here is what a nursing, it is near to helping people, completely free training. If I make to, unless I apply for it, how will I make to our selection process was very strict, but I made to that by God's grace. No matter where you go, try to find that what you can give and take from this thing. It's not what I'm getting. So having that internal and external balance, peace, and being in comfort in that zone, that's what I consider the success is. And I would like to end with this quote that strive not to become a person who is successful, but rather become a person of value. When you become that valuable person, you bring meaning to your own life and you bring meaning to other people in your life. Thank you very much. This is what I want you to take. You are not going to remember everything that I said, right? People mostly forget 80 to 90%. Some of you are, because of this platform, some of you are doing other things on the back, maybe cooking or serving, feeding your kids or watching something else. If you do not remember anything else, just remember 3 things from what I said today, that opportunities everywhere. Remember that grow, that get to know yourself and others and your organization. Reach out to people who can build you up and understand that this opportunity is there. Try to, until you apply for, how will you know? And work for it if that's what you want. Next time when you see an eagle rising up in the sky, think about yourself too. Like, do I want to rise up and learn more? Or do I just want to stay here on the ground and I'm satisfied? So thanks a lot for all your time, and sorry for the technical issues, some from my side too. These are some of the references I use for my talk today. And this is my email. If you don't want to reach out to me, please email me. I'm pretty good in responding. So feel free to reach out to me for your suggestions, comments, or anything that you need to ask. Other than offering a job, I think I will be able to share my life experiences. Thank you very much.
Thank you, Ms. Viji, for your brilliant and wonderful, clear presentation. It was so amazing.
Thank you.
I would say, you lived the way you spoke. Otherwise, I can say, whatever you have lived, you have explained. That's a career advancement. That's how you have grown professionally as well as personally. There are a few questions shared in the WhatsApp group. Can I ask you one by one so that you will be able to answer?
Yeah, please. I will try my best.
Yeah. Like one question is, what's the difference in working in India and US?
All right. Great question. I knew this would be coming. It depends upon who you are and what you want. I never wanted to leave India. I wanted to be, Jai Jawan, Jai Kisan kind of a person, my country, but life happened, married to a civilian, I had to leave army, and this opportunity, having families here, life just took, it happened. But you can grow and become a successful professional anywhere you are. The only difference I would say working in India and US is, in India, nursing is not an autonomous profession. Nursing is a women-centered. As such, in India, the women, for some reason, is considered as a secondary citizen compared to the male-dominant community. So that is also seen in our profession too. The nurses in India, I'm just talking about most, I've seen too, do not feel empowered to speak up to the other professionals, mainly the medical professionals. They think that medical professionals are somewhere very high up and we are very low. No. Here in US, every professional, every worker is considered kind of like, around the same range. How to hold a patient's hand, what that patient needs for pain, because I am the one with 12 hours or 8 hours or 6 hours, whatever work that patient that I'm assigned to. I know that patient well than a doctor who's just rounding, looking at those numbers, looking at this and talking and a few questions. So if I think the pain medication that the patient has been prescribed by the doctor, is he reacting to it? Is he getting comfort with it? Not everyone is going to react to the same thing. And my clinical judgment says that this is not working for the patient. I feel empowered to pick up that phone, talk to my doctor saying, my judgment says that patient is not getting comfort with this pain management. Can we consider this? So we use something called the SBAR, that is the situation, assessment, background, recommendation. So I feel great tool to empower yourself whenever you're talking to another professional. It could be anyone, physical therapist, or saying, you are doing those exercises, the patient is in pain for so many years. Can we take a little slow? So that is a difference I see, that nurses are empowered here at the top of any, like professional you can reach from any level. Nurses are on board of any healthcare platform. Nurses make the biggest workforce of health industry, right? So we feel empowered and at equal with any other healthcare professionals, and compared to that in India. So that's the biggest difference. Of course, money. Then again, which country that you go to, the US is one of the highest paid, whereas in India, again, because it is suppressed profession, so maybe they are not living up to that. The education, what I found is at par with any international level. All that you have to do is, I don't have to go back to school again. Many other professions they have to do, but nursing, I do not have to go back to school. All I have to do a nursing license board exam. If I pass, I get job anywhere in the world. So our education is not the problem. I think it's just the attitude. Thank you.
Well said, Ms. Viji. Okay, there's one more question. This from the first question itself. You said in India, nurses are not autonomous. I mean, in that sense, in US, nurses are autonomous, right? So can you elaborate on this for our better understanding?
Yes, autonomous profession means that anything that is nursing related, that you want to make decision for nursing, your professional practice and for your professional standards, it's the nurses who is making the decision. It's not the doctors who are making the decision. The doctors can be part of a committee or a board for sort out for any, to see, for example, if there is a infection. I would just say the infection rate. So if there is an infection prevention required for central line, I believe all of you know that those patients who have central lines, that's the long catheters that is surgically inserted. So they are associated with like bloodstream infection. So long-term patient care for oncology for cancer patients if it is there. So central line is there. Central line can be a cause for infection. So how to take care of that site is a nursing practice, right? So what kind of we call like a collapsive bundle, like, central line, it's within bloodstream infection that can be prevented by following certain protocols. And so how you develop that is a nursing practice. The dressing is a nursing practice, that's not a medicine practice. So what are the dressing strategies, how to do it, what are material, all these kind of decisions mainly originating from nursing, theoretical background and expertise and experience. Same is with anything of nursing related, professional related or standards and practice. What are the minimum requirements for a nurse to work in an acute care? If I'm working in a ICU, if I'm working in a neonatal ICU, who make that decision? What the nurse should be qualified? It's a nursing body that made that decision, not a medical body that made the decision. So having a empowered, powerful structure of nurses or nursing organizational body that make decisions for nurses, that's what is autonomous means. Whereas in India, most of the decisions are made, I feel, by others. I'm not saying nurses are not part of it, but they do not have that much of a voice.
True, Ms. Viji. In India, it's like a patriarchal kind of society. Again, what nurses are supposed to do is decided by the medical fraternity. Even nurses are not able to practice what they study. There's a lot of theory practice gap in India. So what about the theory practice gap in US? Like it is so close or?
Yes, it is. It is. I mean, that's why we are autonomous. That is what I'm talking about, evidence-based practice. Now, when you want to bring something to your expert professional, whoever that may be, I feel you need to know about it first. Do your research. The best example is you are giving care to a newborn baby, and the practice from the hospital is as soon as the baby is born, you are giving the bottle feed. Then, because you can do start or not breastfeeding initiated, if that is not the practice. Or the example I shared about the bath. After the baby is born, you are giving bath and wrapping the baby, putting the baby as the baby goes. Okay, or the baby is in the nursery. Whatever is the practice. Now you found giving bath immediately to the baby is not good for baby, not for the mother. And I found these researches, how you want to implement this change in your organization. Find out your evidence, put it in a one page. I say that, hey, this is a problem I found. Most of our babies who are admitted to our nursery are hypothermic. Their hypothermia is, now you have to know about how to look for problems and how to look for data. So you have to look, computers help with that, or your hospital statisticians can help you that. Or you might have observed that a lot of the newborn babies having low temperature. And then you're putting warm blanket, you're putting them in incubator to bring that temperature out. And here is what I found, that because we are giving immediate bath and we are not putting that skin to skin, baby is not maintaining temperature, the baby goes under radiant warmer or incubator. If you wipe the baby, put the baby onto the skin, initiate the babies, and then you see that temperatures are staying stable. And the research says that too. So my problem is newborn babies in our newborn nursery not maintaining temperature. Then this is a situation and my problem. And I found, these are the evidences I found, some of the best practices across the world or across in India. And this is what they are doing. Can we try this evidence-based practice for next 3 months to see how our babies are doing? And you get someone, you need permission from your manager, from your administrator, or from your doctors, whoever is making the decision-making body. They say, okay, but you will be responsible. Can you do it alone? No. And get other people excited. Other nurses, all who are working there in that period. Any baby born between 37 weeks to plus, we will do this practice for the next 3 months. So you have to have, and see if that improves. No one is having hypothermia. So that's how you change that practice. So that's how you can bring change. And we do that a lot here. And that's how we improve the clinical excellence. And highly encourage here, any nurse with any experience, if she find a practice, she can prove there is a problem, there is something we want to improve, let's try it. If she follows this protocol, gets all the approval, she gets supported in a magnet hospital. I'm not talking about all the hospitals, definitely from the magnet hospital, yes.
Okay. It's nice to hear the best practices you follow it. It's very sad to say that in India, nursing is like a premise. It has to develop a lot. It has to really overcome a lot of barriers to establish ourselves as nurses. I think I would like to take a few more questions. Is it okay for you, Ms. Viji?
Yes. But I also want to say, don't feel sad, don't feel sorry. Be a part of the momentum. What can I do, even if it is a tiny thing, for that? If we start complaining about our issues, we will never know.
Yes. What is your opinion about fragmentation of nursing roles in the name of specialization? Like you were explaining so many roles, right? So what is your opinion about fragmentation here? All together put it as a one course we offer in India. But what about in US, and what is your opinion about it?
Great question. Now, this is very much about the regional practices and the need of the community and the need of the people. In a metropolitan, you have multi-specialty hospital, right? You have a neurologist, you have a surgeon, you have a obstetrics, everyone specializes in their own care. So you are not going to neurologist for your delivery of the patient. Now, why? Because people understood this specialty. Before, I think 50 years back, or whenever, when India was still under British 70, 80 years back, like there was, okay, doctor took care of everything. We never had this multi-specialty hospital. See, the need is increasing. The community needs specialists, cancer specialists, this specialist, that specialist. So when the need is there, that's how we develop. In a rural setup, having a nurse with this all the specialty that I talked about may not be a reasonable thing. But look at the need, how it goes. Here, the need increased. People, the consumer, have become more and more aware of their specific needs. People are living 80 plus. 80 plus is average here life. So the people, because of that, the lifespan is increased because we have all these development that's happening. To meet that development, specialty hospitals are happening, specialty departments are opening up. So to fulfill that, they need special trained, right? Those who have worked in OR, if you have an OR experience, have you noticed how the doctors want people, the nurses there to be experienced with OR skills? And once you are trained, even certain surgeons want certain team members in their team. Why do you want certain scrub nurse, circulatory nurse on your team? Because you know they are trained, they know exactly what that will help that surgery. So the surgeon is doing one part, but the right equipment, the right support, the right post-operative care. So that's a teamwork. So whoever is part of it, over the years, you gain that skill. And eventually, if that is an empowered surgeon, he always says, I want so-and-so nurse for my surgery. Otherwise, I'm not doing it, or someone to replace or get trained. So that's how the need develops and you evolve into specialty role. You have to know if there is a need or not. I just wanted to share those all global opportunities out there. But if you want to specialize in something particular, find out where that is available and go there. But if you just want to do basic nursing, anywhere you can practice. But basic requirement is basic nursing course.
Thank you, Ms. Viji. Here also there are, team of doctors and nurses. They develop nurses and they want the particular nurse because the nurse is working in particular unit like a transplant unit or a OT. They develop skill and the doctor doesn't want to leave the nurse. But
Yes,
again, yeah. But
and
the payment wise, again, that's no change.
Yeah, and that's where the nurses in INC, TNAI, Nursing Board, Health Ministry should step up. This is what the doctors need. This is what the doctors need. This is what the patients need. We have to develop these certification programs to train our nurses passionate for those. So once you have that specialty training, pediatric 6 months course, 3 months course, or 6 weeks course, start from small something. They will be trained to work in that setting. So that is some of the steps to be taken from higher up level.
Yeah, that's true. There's one more question. How to become an international travel nurse?
International travel nurse.
Nurse,
yeah. So find out from in India itself. And now do not, like I would again say that you have to do your own research. There could be a lot of fraudulent things that's happening. You don't want to fall into false hands, especially when you're young. Do your research to find out, do we have anything in India? In US, we have. So in India, do you have those or not? International travel nurses also are very limited, but here travel nurses are within US and the surrounding areas. They again have to have certain, requirements. There's certain expertise. It could be again specialty wise, some experience, and also license to practice in different places. So finding out, just Google is on your tip, find out if there is anything in India or any other country. You will not find international. I know, like I would love to do that to see different countries. When I was it's a great opportunity for especially the young nurses in their 20s to see different countries, right? So each country has got different requirements. So you will not find a lot of organizations doing that. There is like something called Doctors with No Borders, so there is Medical Mission, but that's a charity profit. So a lot of charity organizations, Christian charities, they do, but that is more like a pro bono. You're going for a 6 month. I have colleagues who do that. They go to African countries and they even come to India, for a mission trip of 4 weeks, 6 weeks, go to Nepal. But then you're not making money. You're in a camp area. You're giving basic nursing care there, along with the medical mission. So please look for what exactly you're looking at.
Yeah, thank you, Ms. Vijay. There's one question from a student, that is, which country is best for nursing job?
Now, what do you mean by best for job? There is nothing best.
Best nursing
In my
job.
speech,
Best
there
nursing
is
job. Yeah.
nothing best, nothing perfect. What do you see? What do you mean by best? Is it money? I just Google. I knew this question will be coming. I and learn about a new country called Luxembourg. Go and Google that, which is the country that's paying highest money. So if that money you are looking for, go to Luxembourg. It is a rural kind of a beautiful country, but you'll be cut off from the rest of the world. If it is second comes US, for money again you come, but then the process to get in US is tough. You know that you have to, there have to be vacancy here. They have to be hiring. Then you have to have a CGFNS exam. Then you have to have IELTS or TOEFL to show that you're proficient in English. Then that's not done. Then again, you have to come here and appear for your board exam, RN board. The transition takes, first 2 years is going to be so tough. Then if you are looking for just charity work, that's your, you just want to just give the underprivileged people, then African countries, those who do not have medical facilities, then in our country itself for that. So I personally feel our country is the best place to work. In India is the best place to work for nursing. It's all about your passion, what you do. No matter where you work, or you can be best nurse,
Yeah.
right?
Maybe your
I went,
answer.
yeah, everywhere I went, do not think that I'm exaggerating. Everywhere I went, by God's grace, because it is my passion and to learn, I volunteered and did. I got those awards because I did my best, not looking for
Yes.
anything else. I didn't want to come to US. I didn't want to leave
Yeah.
army. My life happened, and that's how. So you find what that best means for you, and according to that, any place can be a best place based on how you want to achieve or what you want to do.
Yeah, your answer is truly convincing. Yeah, one question from a faculty member, like you are a successful nurse. How do you become, I mean, how do you balance your work, professional life?
Great, great. Thank you. Thank you. Yeah, many people ask me that. Uh, for me, that quote that you read, right? Live life to the fullest, and every day, like, strive to be your level best and learn some of those things. That's what I live by. That's what I live by. And how you balance that is very important. If you do not have that balance, you won't be successful. And for me, to be successful means that I have to enjoy that as a person. That's why you have to set your priorities right? So I'm a Christian. So for me, I always say my priority number one is God. I know I'm going to leave this world, do my best and go, but ultimately I'm going to the lap of my God. So that's my top priority. Second is my family. Beyond that, my family means my husband, my two kids, and my parents. They're, by God's grace, they're alive, and my brother, extended families come like. So you know to know your priorities. So, and next is my profession, my work. And after that is anything is educational, and then my volunteer work. So this is how I prioritize. And I'm an organized person, a lot of the training from military. At the same time, I've been fortunate to be in a family that was very supportive where I grew up, and I got married into a very supportive family too. And my husband is my cheerleader. That's what I would like to say. Without his support, I won't be able to do right. My profession back in India has been in teaching, so he knows the importance of education and the priority that we set to our kids. I won't do anything that I do not believe in. And I won't tell my kids to do something which I cannot do myself. I will never say anything to you do something which you cannot do. So these are some of the things I learned over the time. So when I know my priorities, I have got, like I say, 5 calendars parallel. So this is my volunteer activity, like, coming to with you. But this is my
Yeah.
volunteer activities give me that joy. My required activities like cooking, cleaning, my kids are big, so everyone join together, we all do it together. Saturdays and Sundays, other than my volunteer activity, I do not do my schoolwork. I do not do my work-related work. I do not check my email. I mean, right now I'm in a leadership position, so that's what is my main work is with people and behind the computer. But so I keep my Saturdays, Sundays like my me time. Saturdays is no discipline time. We do not. I mean, I woke up for today, but this is again because of my passion, something what I enjoy. Otherwise, there's a no alarm, no discipline day. My kids can get up whatever time they want. Even sometimes we get up at 12 o'clock. Very lazy. We may cook, may not. Sunday is my day for worship. So till afternoon, we are, church related activities. And I look what my week is looking forward to next. I'm very organized. I have a calendar that I follow. Then the goal, like I have that goal. My week looks like this. My year looks like this. So like that goal setting is what has helped me to be organized and to know your priorities. So those are the things when you find, then I love watching TV, news, also the, movies. I do everything. Like I want this, I want that. That's kind of a person I am. But when I'm seeing something, I learned that, like if you're doing cooking, I learned a lot of, I won't go and chop. Someone tells, when you chop onion and ginger and garlic to make tiny, then only it tastes good. When there is a chopper, I will use chopper. Within 2 seconds, my work is done than spending 15 minutes chopping that. So I've learned to use technology, equipments, and my skills and what I love with the best practices that others are sharing for anything in your personal life, in your professional life. You learn from the best. Try, is it working for you? So that you're spending less time on doing a task and more time in what something you're enjoying. I hope that helps me. That's what is working for me.
Yes, yes. It's no doubt you are a multi-talented personality. One more question from faculty, and there's one more question from the student. With this, we'll close the question answer session. The question is here in India, to do a PhD, you have to have a master's in nursing. But you are doing doctorate in nursing practice, but you have a master's degree in sociology. Is that fine in US? Still you can go ahead without having a master's degree?
Great question, great question. Now, as I mentioned, the education system in US and education system in India is different. In education system that I went to in India, this I'm talking about 25, 30 years back in the school, the 9th and 10th grade, we learned we did the board exam completely 9th and 10th grade. I cannot memorize anything. I remember mugging up so many things and doing am I using in my life or in my college or when I went to school? No. So here, even from the beginning, your education is, you are very credit based. So kind of a 3-level system. If you just want to do, there's up to high school basic education for everyone. There is certain credits that you have to have a math subject, you have to have science, English, most of the is related to math and reading. Science and other things are added up to depending upon the passion, what path you're choosing. So it's 28 certain credits you have to get to pass out your basic high school. Every child has to do that. Even then there is a level of regular school. There is a pre-advanced and advanced. So pre-advanced regular school is just basic learning. You learn the basic math and English and there's a different path. If you're a little bit more confident, pre-advanced and advanced. So that's how you develop. When you go to college, not everyone able to go to college. It's very expensive here to go to college. By the high school, you are finding a path. I want to go to medical. You're not doing only one entrance exam alone is not going to get a medical school examination, medical school admission. You need a lot of other things to that. That's how you get admission to a school, college. Here they normally call school. Depending upon your passion, are you able to perform what you're doing? I know doctors who have done computer science. Can you believe? I know doctors and nurses, a nurse who's been teacher for 40 years and then went back to school to become a nurse. So here you lifelong that education is there. So I did my master's. That master's is not going to be applied for other purposes for my job and also yes, for my higher nursing education, it was not accepted. I'm not getting any master's credit. So I didn't want to get another master's degree. So just recently, just 3-4 years, I think they started a bridge program called BSN to DNP. So I had to do 1 year extra versus a bridge program of the master's classes that I'm taking. But I will be doing, so others who has got master's degree will do DNP maybe 2 years, 2.5 years. Whereas I'm doing the bridge program BSN to DNP, again, according to my need and my experience and expertise, and the BSN to DNP program is different and MSN to DNP program is different. So I'm in that track and I'll be doing 3.5 to 4 years of course to pass that. Okay. So education system is different here, and definitely you need a solid nursing background to do a nursing doctorate program. I hope that answers.
Thank you, Ms. Thank you. There's one question, one last question. Like, what are the educational opportunities in abroad after completing DGNM, BSc, and MSc nursing in India?
So
So
education,
higher educational opportunities for nurses who have already completed DGNM, BSc, and MSc. Is there any difference? Or
so yes, so great question again. So for to practice your profession, you need a license. That's why I was just saying like professional practice requires a license. Once you get your RN license, that proves you are able to practice the profession you learned. Now you want to advance your education. You have to say if you are a general nurse, you want to do BSN, you can go here. There's online courses available. There's mixed classes. All that is available for anyone. I've seen people, general nurses from here, from India, came here, become successful doctors in nursing practice and nurse practitioners and practicing as independent nurse practitioners here in India. And I salute to all those who have been in school for so many years. They came from India, but been like 10, 12 years and completed those things and are practicing independently and very successful. So you get your license, get to know system. It takes on an average 1 to 2 years to get to know the country. Even, driving is on the opposite side. Even the switch is opposite here. Everything I say is everything is upside down here. India. Every country, get to know that country, get to know the requirements wherever you are going, and educational opportunities are out there. In the Middle East where I worked, there was not much of the educational opportunities to grow into maybe some courses. I did some management course there, administration courses there, the short courses, but not a formal educational program at that time. I did not find one, was not there. Maybe now it is, been years back, 20 some years back. So find out where you get an opportunity to go to and what are the requirements and opportunities available here. If you get to be here in the US, opportunities are endless. You will find you can become anything. My sister-in-law, who's retired nurse now, my husband's sister, and she, one of her classmates, she's a nurse from India who came here. She did her master's, but always in her mind, she wanted to be a doctor. Eventually, she became doctor, and her 2 kids are also doctor. So she went to become a doctor after 15 or 20 years of a nursing practice. So you can do anything if you are passionate and you know how to get there and where you have that opportunity. And you have to have that opportunity you have to be in the right place at the right time, in the right spirit to do it, and you can do it.
Thank you, Ms. Viji, for the perfect handling of question answer session. It's just all your answers are most convincing. Yeah, well, we have come to an end of question answer session. Like we had to formally wind up. Before I wind up, I would like to give a vote of thanks to everyone who has helped us. First of all, I would like to sincerely thank you for the elaborative and excellent presentation. You are a true leader and educator. As I said already, you live the way you spoke. And having you on this Teachers' Day in India is something very memorable for us. You have really, the information which you gave us, very, very, very informative. It's very apt to have you talk about career opportunities because the way you have grown, you have elaborated in a clear way. Hope all our students could have understood all the opportunities in nurses in abroad. And I'm sure you have done the justice to your presentation. Thank you for sparing your valuable time, sharing your expertise with us. I'm sure after listening to your presentation on career advancement, our students got inspired. Not only our students, our faculty members got inspired and motivated. And definitely, for sure, they grow to become smarter. No doubt about it. And I'm sure they could have understood opportunities everywhere. That mantra they will remember forever. And also how you have nicely elaborated on the word grow, that they will remember forever, I'm sure. Also, I can't understand from Dr. Prema that you are very good in counseling and you are an artist, you can draw very well. Now I understood, because to be an artist, it needs a lot of focus and attention. The same quality you have focused, same quality you have imbibed in nursing profession too. That's how you are so focused and so organized. That's how you could grow professionally to inspire many more people. And also one information which is not there in your thing, but I want to tell it for our benefit of our students. You also served as SNA Vice President during your college days. That is something amazing because your leadership quality started from there and you continue to grow yourself as a true leader, personally as well as professionally. Thanks a lot for your time. And again, at this junction, I would feel sorry for that. The technical delay, even after I started introducing, I faced the same difficulty. I got disconnected and I have to join again. And
That's beyond my
thank you so
control.
much for the patience. Thank you so much for your patience. And like, when you visit India, you must come to our organization. You must visit our place. We want to have you as one of our family member of Maccon, and we would like to continue our association and relationship forever. Thank you, Ms. Viji. Before I wind up, Prema, would you like to say something? You're on travel, I know. Is it possible for you to say a few words? Prema?
Vijay has not changed. Yeah. Can you hear me, sir? Hello.
Yeah, we can hear you.
Vijay has not changed. She's the same Vijay. Yeah, she's the same Vijay. I saw her years back. And and as batch, we are all like that.
And I would say the same for Prema too. I think we were fortunate to be part of military. Prema is, I always admired Prema, very disciplined, as if you all of know that too. It goes to a lot to our personality. They have certain personality to be trained into, to get selected to, and also trained. So thanks to all our teachers. Thank you.
Yes, yes. Yeah.
Thank you so much,
Thank you,
Vijay, for
Prema.
being with us. Thank you, sir.
Yeah. Thank you, Prema. Before wind up, I would like to thank Dr. Prema once again for introducing such a wonderful speaker for us and for all the support she has given to organize this webinar. And I thank all our faculty members. A special word to Mrs. Elizabeth Rani, who prepared the invitation and the feedback form, and all the faculty members and students, and Mr. Raja for all the technical support from the college. Thank you so much. Dear students, there is a feedback form posted in the chat, as well as which will be posted in the WhatsApp group. I would like all of you to fill the feedback form and submit. Thank you, Ms. Viji. Thank you so much for your wonderful presentation. Thank you.
I thank you sincerely from bottom of my heart for this opportunity and for getting to know each one of you. Please reach out to me. And I know many people worked hours to get this organized and arranged, and some of you are staying late to attend this. Thank you for attending. Have a blessed day.
Thank you. Thank you so much. Thank you. We officially end this meeting.